Good afternoon, everyone, and welcome to our program this afternoon. I'm Dr. Christina Wells, and I am the Health Ministry Director for the Lake Region Conference of Seventh-day Adventists. I've missed you guys. We've been gone for a few months. I know we had a lot in the beginning of the year, took a few months off, but glad to be back with you this afternoon to talk about an important subject, which is breast cancer awareness. And we've got a wonderful lineup for you for this afternoon. So if you have a friend, share this link with someone else, with your family, your friends, because they're going to be in for a treat this afternoon. Again, I bring you greetings on behalf of our president, Garth Gabriel of the Lake Region Conference, our admin team, our directors, our staff, our pastors, and everyone in the Lake Region Conference. We have, as I said, some great speakers for you this afternoon. And our first person that we're going to bring up in just a few minutes is going to be Dr. Sharon Raymond. And she is a board certified obstetrician gynecologist. She received her medical degree from the Yale School of Medicine and her MBA from the University of Pittsburgh. She currently works as a clinician, an educator, as a speaker, and a thought leader. And she is going to bring us some wealth of information about breast cancer. And then we're going to have Kim Nolan and her daughter, Micah Logan. And Kim Logan is a licensed professional counselor and the CEO of Kim Logan Communications and the executive director of the Christian Family Counseling Clinic in Detroit, Michigan. Her daughter, Micah Logan, is a radio personality, and they're going to share their survivorship story with us today. And I know that that's going to be an amazing blessing for us. And then we're going to have Stephanie Ignacio, and she's a plant interventionist and the founder of Plantspiration NFP Incorporated. And she's a Food for Life instructor with the Physicians Committee for Responsible Medicine. And she's going to talk to us about some recipes and some ways in which we can eat and have some healthy lifestyle changes to help prevent breast cancer. And so I want to tell you, this show is not just for women only. This is for men as well. And so we want everyone to be informed about how we can live healthier lives and be aware, which is the first step to living that healthier life. So again, share this link with your family and friends. And we are going to have a quick word of prayer. And then we are going to get started with Dr. Sharon. Let us pray. Dear Heavenly Father, Lord God, thank you for this Sabbath day. Thank you for bringing us here. And may this program be a blessing to all who will watch it. In Jesus' name we pray. Amen. And so now we're going to bring on Dr. Sharon. Hi, Dr. Sharon. How are you?
I'm well. How are you, Dr. Wells?
I am well. I am well. I am so grateful that you agreed to be on our program today. And we know that you are going to be sharing so many wonderful things for us today. And so I'm going to get you started. And just again, like I said, let me know when you want me to advance your slides.
Absolutely. I just want to thank you, Dr. Wells, and also for all of those that are involved with this conference for taking the time to try to educate women, try to make us more aware. And I thank you for this invitation. And I also pray that what I may say will be thought provoking and lead someone to um, do something different, to love themselves a little better, to take care of themselves. So, if we can get started, every October there's breast cancer awareness. And oh, Dr. Wells, I should say, I only have 6 slides, but I can be long winded. If I start to go over, please let me know. I don't want to have any speaker not have their allotted time. So to continue, breast development. Breast development starts at puberty. It is, when we think about it, the only visible sign to the world that she has reached sexual maturation. As such, breasts are often linked to sexual pleasure, arousal, attracting a partner, and for some of us, it defines our femininity. Yet, I think most health professionals would say that the primary biological function of the breast is to produce milk to feed one's offspring. So, in that sense, breasts have a life sustaining function. So, it's ironic that globally now breast cancer is the number one cancer in women. In 2021, the World Health Organization declared breast cancer as the most commonly diagnosed cancer in the world. In 2020, there were 2.3 million cases of breast cancer diagnosed. This was previously lung cancer had been the most frequent, the most commonly diagnosed cancer. So, given the above statistics, one might suspect that breast cancer is, in fact, the number one threat to women's health. For all of us, this is a dreaded diagnosis, but the reality is that breast cancer is not the number one killer of women. Heart disease. Heart disease is the number one killer of women in the US. To give you a comparison, in 2020, 42,275 females died of breast cancer. 42,275. In 2020, 314,186 women died of heart disease. In fact, it's been noted that the most common cause of death for a woman with breast cancer is actually cardiovascular disease. Next slide, please. So this is just a really quick review of anatomy so that we're all on the same page. Each breast contains about 15 to 20 lobes, and each lobe is comprised of multiple lobules, and this has been compared to a cluster of grapes. And these cluster of grapes are surrounded by fatty tissue and fibrous tissue. The milk gets produced in the lobules, or what would be the equivalent of the grapes. They then get transported into the ducts, and in that picture would be the equivalent of a branch. And then the milk exits through the nipple. As noted before, fat fills the space between the lobules and the ducts, and it's actually the fat that determines the size of the breast. There is no muscle in the breast, but there is muscle that lies beneath the breast. The breast does have blood vessels and lymph nodes, and the lymph nodes are often clustered under the arm, above the clavicle, in the chest area. So you may have heard the term dense breast. She has dense breasts. And what that's referring to is that this woman has a lot of glandular or fibrous tissue in her breast. That would be the equivalent of having a lot of grape clusters and not a lot of leaves, which represent the fat. So that makes it harder to see any abnormality when the tissue is thick, which is why dense breast tends to be considered a risk factor. Dense breast is usually more common in younger women. As we get older, there's a greater replacement by fatty tissue, and dense breasts tend to be more common in women who have smaller breasts. You may have also heard the term, she has fibrocystic breasts or lumpy tender breasts. And these changes are often secondary to hormonal changes, which means that it's always important to time your breast examination just before your cycle, when breasts tend to get tender and larger and lumpier, is not the ideal time. The ideal time for an examination, whether we're talking about a breast self-examination, a clinical examination, or a mammogram, is the week after your menstrual cycle. Speaking of that, just briefly touching on breast self-examinations, since 2015, the American Cancer Society has recommended that women not do breast self-examinations, and the reasoning was it doesn't help to it doesn't help to increase survival, and it leads to a lot of what we call false positives, or quote unquote unnecessary worry. They've since changed that and modified it to say, if we don't necessarily want women to obsess with breast self-examinations, but we do feel that women should be aware of their breasts, the texture of their breasts, the quote unquote lumpiness of their breasts, so that if there is a change, they would be able to detect it. And the last thing I say before we go to the next slide is that the most common cancer is an invasive ductal carcinoma. This occurs about 75% of the time. Next slide, please. So that picture is what a mammogram looks like, right and left breasts. And so there are often lots of questions about mammograms. One of it is, well, first of all, what is a mammogram? A mammogram is essentially an X-ray of the breast. It's a relatively simple procedure. The breast is compressed between two plates. You take images from side to side and top to bottom. It should take approximately 20 minutes. Does it hurt? Again, it may depend on where you are in your cycle. Often avoiding caffeine helps to decrease any tenderness, and also just the technician and their ability to place the breast onto the plate in a proper fashion. The idea is that you want to level the breast so that you can get maximum penetration and visualization. In this mammogram that we're looking at, the white tissue would be the glandular tissue. The dark tissue is fatty tissue, and then there's fibrous tissue in the breast. So you can imagine that a woman who has a very dense breast or lots of glandular tissue, it might be harder for a radiologist to detect an abnormality. What types of mammograms are there? There's screening, and there are also diagnostic mammograms. A screening mammogram is just a routine. She does not have any particular complaint concerning her breasts. A diagnostic mammogram is when there's been a detected abnormality or tenderness, and that requires closer observation. There are often two types of mammograms. One is a 2D, 3D mammogram. A 2D mammogram, which is the older of the two, are really just two views of the breasts, side to side, front to back, from top to bottom of each breast. So you end up with 4 pictures, 2 for each breast. A 3D mammogram is different. That's when you take multiple pictures of the breast over an arc, and then you reassemble those pictures to form a 3D image. It's not clear if all insurances will now pay for 3D mammograms. They tend to be reserved for those women who have higher risk or for whatever reason. So we've talked briefly about dense breast, and that, just to repeat, is just when there is a lot of glandular tissue which appears white on a mammogram, which makes it harder for a radiologist to view. So risk factors, am I at risk? Am I at high risk? Do I have a normal risk? How do I determine my relative risk of having breast cancer? And there's certain things that we have no control over. So getting older puts us at an increased risk for breast cancer. It's reported that 83% of the women diagnosed with breast cancer are over the age of 50. Having a genetic mutation such as BRCA1 or BRCA2, starting your menstrual cycle, menarche, before the age of 12, or having your menopause after the age of 55, having dense breasts, having a personal history of breast cancer puts you at risk for developing breast cancer a second time. Having a family history, first-degree relatives or multiple relatives, including male relatives, or having history of cancer such as ovarian cancer. If you've had previous radiation to your chest or the breast, and also if you've had a mother that's taken DES, or if you yourself have taken DES. Things that we have a little more control over is our physicality. Not being physically active puts us at an increased risk. Being overweight or obese, particularly after menopause. Taking hormonal replacement for over 5 years has been associated with an increased risk. Having a first pregnancy after the age of 30, not breastfeeding, or never having a full-term pregnancy. The others are, these last two are also very concerning. Drinking alcohol. It's been reported that drinking alcohol will increase a woman's risk for breast cancer. And the recommendation, the 2020-2025 dietary guidelines, actually recommends that adults not drink, or that they have one or less drink per day. And the other entity that's starting now to gender greater interest is eating ultra-processed foods, foods that have chemicals, endocrine disruptive chemicals, which can look like estrogen, may increase a woman's risk for breast cancer. Next slide, please. Now, I don't want you to try to read this. The whole point of this is to show that depending on which organization, and these are all professional medical organizations, which one you listen to, there are different recommendations as to when a woman should start a mammogram, how often she should have it, whether or not she should have a clinical self-breast examination. And the difference between a self-examination and a clinical breast examination is that a clinical breast examination is performed by a health professional. So what I'll do is just look at the first three recommendations, the first three organizations: the U.S. Preventive Task Force, the American Cancer Society, and the American College of OBGYN. And we'll compare what they say as to what women should do that are between the age of 40 and 49. The U.S. Preventive Task Force says really it's an individual decision. We don't necessarily recommend it. The American Cancer Society says we feel that way up until the age of 45. After the age of 45, we think women should start getting mammograms. And we're talking about women who are considered average risk at this point, I should say that. The American Cancer Society says that starting at the age of 45, women should start getting mammograms every year. The American College of OBGYN says actually you should start offering a mammogram to a woman at the age of 40, and then offer it to her every 1 to 2 years, depending on her preference. Now, between the age of 50 and 74, and we've already said this is the age where there's a higher incidence of breast cancer, the U.S. Task Force says mammograms should be done every 2 years. The American Cancer Society says up to 55, one every year, and then after 55, 1 to 2 years. The American College of OBGYN says every 1 to 2 years. In terms of clinical breast examination, US Task Force says we don't have enough evidence to make an opinion about this one way or the other. The American Cancer Society says we do not recommend, and the American College of OBGYN says it should be offered to women. So my point is, it's been very confusing, and it's hard to know exactly what to tell a woman in terms of her risk. Just recently, the organization NCCN, which stands for the National Comprehensive Cancer Network, tried to come together and make a consensus about when and how often women should get mammograms. And their recommendation is that women should start at the age of 40 getting mammograms every year. Next slide, please. And we have to wonder about the health disparities that we see with breast cancer. And if you look at the graph, it shows you by race and ethnicity. The blue is the incidence of cancer, and we see that the highest incidence of cancer is among white women. And then the red represents mortality, the mortality rate for breast cancer. And we can see that Black women have the highest mortality rate for breast cancer. In fact, over the past 10 years, this higher mortality rate has been persistent. In fact, it's felt to be about 40% higher for Black women compared to white women. And there's not a good explanation for that. We know that Black women tend to have a higher risk for what's called triple negative breast cancer, which is maybe about 2 times higher for white women, 3 times higher for women of other races. And so the question is, we've known about this healthcare disparity. We have not been able to identify exactly why. And so people are looking for other reasons, such as, is it because of inherited genes? Is it because of the environment? Is it because of chemicals? Is it because of socioeconomic status? Is it because of medical racism and the type of care or the lack of care a Black woman might receive? All currently not known. Next slide, please. I think I'm going to come in under the wire. So the last part is that looking forward, there are things that women can do to lessen their risks for breast cancer, and that involves monitoring their weight and trying to get into optimal weight, trying to be physically active, and limiting or eliminating alcohol. And the last thing I'd like to do is briefly allow everyone in the audience to do a self-assessment. I have 12 questions. If you answer yes to the questions, the more times you answer yes, the higher your risk. So these are the 12 questions. Do you have a family history of breast cancer, ovarian cancer, or melanoma? Yes or no. Question number 2, have you been tested positive? Have you tested positive for BRCA1 or BRCA2 gene mutation? Yes or no. Have you ever had a biopsy independent of the result? Yes or no. Have you ever had radiation to your face or your chest before the age of 30? Have you been told you have dense breasts? Yes or no. Do you have a BMI, body mass index, greater than 30? Yes, no. Is your frequency of exercise less than 3 times per week? Have you used menopausal hormones for more than 5 years? Do you consume more than 3 alcoholic drinks per week? And two more. Do you eat ultra processed foods such as prepared frozen meals, canned prepackaged foods, fast foods, trans fats? Do you smoke? And have you been unable to carry a pregnancy to full term? Or have you, yes or no? And then the last question, which I call the bonus question, are you African American? Yes or no? The more yeses that you had, theoretically, the higher your risk. And I would ask you to review and share these results with your health professional, and then decide how best to manage your risk. Thank you.
Thank you for that information. And that was very, very informative. And I have a couple of questions for you before you go. I'm just going to ask you the questions now before we move on to our next speakers, who are going to be Dr. Kim and Micah Logan, who are going to talk about their experience with breast cancer. But just a couple of questions. And you've covered a lot of these already. You told us that Black women are at greater risk and they don't have the greatest incidence. So that means that they don't get it more than other people, but they're at greater risk from dying from breast cancer. And there are probably multiple factors that go into that, whether it's environmental, socioeconomic, discrimination, access to care, quality of care provided. All of those are it's probably multifactorial. So I thank you for that information. I was going to ask you what age to start screening, but you also talked about that. In my practice, and I want to know just what you do in your personal practice. In my practice, I let women know at 40 that they can start it, but I let it be a shared decision making. So I let them decide, and we talk about their family history, other risk factors. What do you do in your practice?
So I would say my experience is, even though I started off this talk saying really the thing we need to be concerned about is cardiovascular disease, women have a real visceral fear of being told that they have breast cancer. And so for the majority of women, because of all the confusion with the recommendations, for the majority of women, they would opt to test sooner than later. And so I do recommend that women do breast self-examination. It's part of your body. You should know what it feels like. You should be able to detect when there's a change. So you don't have to obsess about it, but you should know it's your body. You should know what it feels like. So I recommend that. And I do a clinical breast examination in the office because I want to emphasize that we should be doing that they should also be doing that. And then I will default to the age of 40. If she says she doesn't want to, or she wants to do it every 2 years, I'm fine with that.
Right. And I think I do. That's great recommendations. I tell women, your breasts are with you all the time. You're going to be the first person to notice when something is not right. And so knowing what they normally feel like so that you know when something is not right is going to be important. So thank you for sharing that. One last question here. And then if you have any other comments to share, that would be great. You talked about doing a self breast exam. What are some of the warning signs that women should be aware of when performing that breast exam?
So this is it. The beauty of the breast self-examination is that over time, you get comfortable with what you're feeling. And that's the whole point. Once you're comfortable and once you know what your breasts feel like, then you should be able to detect a change. And that's the whole point. And it doesn't necessarily mean you have cancer. That means there's a change which warrants further evaluation. And so it's like, don't obsess about it when you're in the bathtub or the shower using soapy water, which helps with the tactile feel. Just go over your breasts. Go over your breasts. And then you'll start to appreciate, I say that breast has texture. It's not just smooth. And we know from the pictures of the grapes, there's texture to your breast. And so you should be able to say, that's what it feels like. And also know that that texture may change depending where you are in your menstrual cycle. And so,
Wonderful, wonderful. That's great, great advice that you've given. I like the cluster of grapes analogy that you gave before, so I might steal that when I'm talking to my patients. But I appreciate that. That was a wonderful analogy. Anything else that you want to tell our audience before we go to talk to our breast cancer survivors?
well, I was thinking about this in that with the 7 Day Adventist, there's always an emphasis towards diet and eating well. And I think that's never more important than right now when we're talking about breast cancer, when we know that how we eat may modify your risk. And that's huge. And when we know that cardiovascular disease is prevalent, not only for breast cancer patients, but for all of us. And if we can modify that through diet and not need a medication or not need a surgical procedure, we should do that.
And I appreciate you saying that because that is so true. And yes, we're going to be talking as towards the end of the program more about diet and how that can help in prevention, the benefits of soy, and maybe trying to debunk some of the myths about soy and that it
Absolutely.
actually can be protective. So if you're able to stick around, we'll bring you back on later. But if not, we appreciate all the information that you have given. It has been so wonderful. We thank you for your wealth of knowledge and for all that you're doing. Tell us a little bit before you go real quick about Today's Woman. What is that?
Oh, well, that's my baby. It's a GYN only practice, and it's focused. It's for women of all ages. I mean, we like all women, but we have a special fondness for women in midlife, and that's 40 to 64. And so that's where our focus is. We want every woman to optimize her health. We know that how you take care of yourself during this period of time will impact the rest of your life, the quality of your life. And we want to have a positive effect.
Well, wonderful. Thank you again for all that you do. We hope that you'll be able to stick around, but if not, we know we're going to get you back on for another program. So we'll see you in a little bit. Thank you, Dr.
Thank
Rowland.
you again. I appreciate it.
All right, that was some wonderful information. Again, share this program with your family and friends. And now we're going to bring on Dr. Kim and her daughter Micah. So great to see you all.
Hi.
And I'm going to kind of just sit here and listen. I'm going to stay on the screen with you guys just in case I want to throw a question in. But we know that you guys have some awesome stories. And so I don't know who wants to go first, but we really want to hear about your experience with breast cancer and anything that you think would be helpful to share with women in terms of lessons learned, how you made it through, what it was like, whatever you feel on your heart you want to share. We want to hear your stories today. And thank you so much, Dr. Kim and Micah, for coming on today.
It's our joy. I really want Micah to start because that's where the story begins.
Okay. Hello, everybody. My name is Micah, and I was diagnosed with breast cancer, stage 2 invasive ductal carcinoma at the age of 31. My age bracket is not on any chart. It's not on any statistics. They say 40 and up. Well, if I would have missed my annual consecutively year after year after year after year, I would have waited till I was 40, I would be dead right now. My problem, I'm going to start with this. My problem with all the information that's out there is there's nothing that talks about women 18 to 39. Because what I found out after my diagnosis was that women 18 to 39 are definitely, Black women especially, are definitely getting breast cancer. And it's unfortunate that that age group and bracket is not talked about as much as it should be. from 1 year to 1 year, from getting my annual, I had a tumor growing inside of me that I had no idea about. I didn't know about the fact that I had an inverted nipple, that was a sign that there was something wrong. The education was not available unto me. I didn't know anything about breast cancer other than the fact they wore pink. And at the time, I hated the color pink. I didn't even know how to spell mammogram. I didn't know the type of things that were out there. And what was really interesting to me was the fact that so many women in the church have had it and have said nothing to help educate others. And I get it. Everybody, it's that whole what goes on at home stays at home, not understanding that your testimony really can help somebody else. Beyond the testimony, it's the information that is happening to Black women, it's happening to Christian women, and it's going on with younger women. I remember when I found out, it was one of those things where it was just kind of like, I was at work, I was on air, I'm a radio host, and the doctor's talking to me, and I'm answering the phone on air because surely she's not about to tell me I have cancer. Because what? We had been going through a series of things in our family. My mom, the business randomly had a fire. We were dealing with my grandmother and her going through remission with a whole different type of cancer, totally unrelated. And it was just a lot going on in our family. And I was just like, nah, like we need a break. And God was like, nah, you don't. So it was one of those things where I found out, I immediately called my parents. And of course, my mom, then my dad, oh, we got to get on the plane. We got to get there. And I was like, no. At the time, my grandmother was living, my aunt was living in Huntsville, my cousins, and they went to the doctor with me. And I can be honest with you, I literally heard nothing. Thank God for my aunt and my grandmother because they took notes. But what I found was really interesting that my doctor, who's amazing, I've been going to her for the last 9 years, Dr. Melanie Scott, she started crying because I was her youngest patient. And she didn't understand why. I was healthy. I was a vegetarian. I was, just about that life. I didn't have any issues that she couldn't understand. None of my doctors, my team, they could not understand what was happening. I took every gene test known to man. Nothing. And I remember walking in and I said to them, hey, y'all can stop looking. I asked God for 3 things at the top of January of 2013. I asked him to increase my faith, help me appreciate my job better, and just like all of the things that I asked for, God actually answered those prayers through breast cancer. So it was one of those type things that it was really a faith walk for me. I did everything. I went to work, except for the days that I had chemo. I drove myself. My father offered to move down with me and live with me. And though I said no, upon reflection, I wish I would have said yes just to have a little more time with him. But I was like, no, I'm okay. I gotta do this thing on my own because there were nights where the pain was so bad. I had my chemo on a Thursday, and then on Friday I would go in to get a white blood cell immune shot and to boost my white blood cells, because what the chemo does, for those of you who don't know, it literally wipes out good and bad cells. And it would feel like I had 3 heavyweight boxers beating up on me at night. And so I would get through the night and I would just have to pray and talk to God about it. It was really nothing anybody could physically do for me. And then I would get up the next morning and I remember telling myself that my goal was to live. Whatever I needed to go to, and I was going to go to parties. Now I might be sleeping in the corner because I was tired from chemo, but I was gonna go and enjoy life. I remember we took a family trip to Hawaii, and I had to get 2 chemo treatments back to back, and it was hard. It was really hard for my mom because she didn't really understand what I was going through. She couldn't understand that I didn't want to talk on the phone. She didn't understand that I didn't want to go shopping after my chemo. She didn't understand that it was just certain things. When my hair started falling out, my dad was like, I need you to take control of it. Go to the barbershop and just go get your hair cut. And I was like, what? He was like, go to the barbershop and go get your hair cut. He was like, I'm gonna love your little chocolate head. And I remember my mom was at camp meeting, and she was just like, why would you do that? And I was like, because my hair's falling out. And she just couldn't understand. And to keep it all the way but she didn't talk to me for several days. And I was just like, what is hair? Like, it's falling out. What am I gonna do? Like, it was a very hard situation. My grandmother, I did all the cleaning out, I took all the processed foods out, I took this stuff called greens and more. I took that. I took all types of vitamins and herbs and things of that nature. I was blessed because though my cancer was estrogen based, I had to get rid of all the soy, aka all that veggie meat that was in my freezer. I had to get rid of all of that. I was blessed though because the weight that I went in was the exact same weight when I finished all of my treatments. I didn't have any crazy side effects with the steroids or anything like that. It was at a point where there were days I didn't feel like eating. So I drank Ensure, like just to get something in my system. There were times where, they tell you don't eat the things that are your favorite foods. So I tried to stay away from all the favorite things. Now, what I don't eat to this day, I don't eat pesto pasta and I don't eat oatmeal, which I used to love, but those are the two things that I could actually stomach during chemo. I haven't touched oatmeal since 2013. You're not gonna get me to do it because it tasted like chalk. But what I found out was I put hot sauce on everything, and peppermint oil definitely helped me be able to even take water. The peppermint oil that you had, and this is the stuff that they're not going to tell you. It's kind of trial and error as you go, but I try to make sure that anybody that comes in my inbox and asks me what did I do, I just give them the real. I don't give them all that statistic stuff. That's great, but that it was for me. I remember I had to tell my mom, don't send me nothing else. Don't send me another book, another pamphlet. It was one of those things that everybody's journey is their own personal journey, and you have to get through it the best way that you can. I remember a lady at the church, my mom, the prayer warrior, she wanted everybody to know. I did not want everybody to know what I was going through, not because I didn't want people praying for me, but I had to process. And God did not give me clearance to share with everybody. And people have to really understand that when you're going through something, you really have to ask God to give you clearance on when to share that thing and how impactful it will be, not only to yourself and to others. But I remember a lady got on the phone with me and said, girl, just go ahead and cut him off. You'll find a man that'll love you. Ma'am, I'm not even thinking about no man right now. I'm thinking about how I'm going to get through this and what all this means. And I know she didn't mean any harm, and I love her to this day. But it was one of those things where after I had 18 weeks of chemo, a lumpectomy, and 37 consecutive treatments of radiation. And then I was declared, officially cancer-free. But then I got a scare and they thought that it came back. And I didn't tell anybody. I had to tell my parents because I had to go under anesthesia. But it was one of those things where my faith was tested again because I was like, come on, God. Like everybody celebrated me being done. And it might be back. And it was a scare, but it was just some scar tissue. It was cool. But that's one of the things they don't tell you when you go through remission. There's always, no matter how much faith you have, no matter how much trust you have in God, as a human that has gone through something that has the possibility of coming back, there's something always in the back of your head when something goes wrong in here that, oh man, did it come back? This is why it's so important, especially when you are declared cancer free, you got to go to those checks every year. You got to take care of your bodies. I tell people that are young, do the checks in the bathroom. Because you go down, you go to the OBGYN and they ask you, and you don't really tell the truth. Like, oh, you doing your self-check? And you'll be like, kind of. Nah, you got to do those self-checks. They're important and they tell you to do them for a reason. I tell people in my age group that I was sitting with my friends at Stanley's. They came down to see me and it was 8 of us. And I was looking around and I was like, yo, I was the 1 in 8. 1 in 8 women get breast cancer. And I was literally the one of the 8 of us collectively that were sitting at that table. And it got real. And I had to stop. They were mid-conversation. And I was like, you guys. And I said it. And it really made it a reality for my friends. And now, because of me, they are really adamant every year to go get their breast exams. I tell people all the time that when things happen to you, it's not necessarily happening to you. It's happening for you to help someone else. My journey was not for me, I don't believe, because after I got free and clear, my grandmother got a cancer and had to go through treatment that she never had to go before. And in the family, I understood what chemo was. So I was able to share and help my family understand this is what she's going through. This is what's happening. And my grandmother and I had a really, really special bond. Fast forward to my father, him getting sick Before that was we had an aunt that got cancer and died within a week's time. It was really fast. And then after that, it was my dad, and it was just a lot. And so then I suffered survivor's remorse. I went through this thing called survivor's remorse really, really bad because I couldn't understand why people that I love the most around me were getting all these different forms of cancer and they weren't living, yet I was able to live through it. And so that was something that when I hit year 5, I was really struggling with, on top of getting a phone call from my mother that I was at the nail shop and I was pulling up to the nail shop. And this is a year after my father died. And my mother tells me that she's diagnosed. And I remember sitting in that car and I said, okay, God, I need you to do me a favor. If she got to have it, she got to have it. But what I need for you to do is please don't let her go through everything that I went through. I can't take it. She can't take it. Please don't let her have to go through everything that I went through. And then, Mom, you're up.
Oh, that's amazing. Yes, I remember sitting in my office and my doctor called me, Dr. Sharon Miller, and my OBGYN, awesome. She was crying because we're dear friends. And I said, come on now, we're not doing this. We're women of faith. And she said, your second test result came back malignant. And I said, okay. So we prayed, what's the next step? And then she said, we have to meet with the tumor board. The first call I made was to Micah. Now I had a daughter in her senior year. My youngest daughter's in her senior year at Oakwood Academy. So we decided not to tell Aaron until after graduation because we didn't want anything to spoil that. So from April till I went down for Memorial Weekend was the graduation in 2018. I had to go through all of that. I went through the surgery. I went through, and the radiation began when I got back because you can't miss any dates. And I remember Micah saying to me, you know, no processed food. We have to use what vitamins. And I know that the Lord allowed my child to go through this to help me get through this, to have this breakthrough. I remember one time, Dr. Christine, that I was sitting with my oncologist, Dr. Robert Bloom, amazing. And he said, now we have to go through the medication and chemo. I said, oh, I'm done. Surgery, radiation, I'm done. He said, oh, okay. He said, can I have your next closest relative on the phone? Mm-hmm. So I asked my daughter, Micah. So he said, Micah, hi, I'm Dr. Bloom, and I'm your mother's oncologist. We got the cancer out. She's doing well. However, she's refusing chemo and the medication. And so it will come back aggressively, and this time she will die. Micah was on the speakerphone. She says, may I speak to my mother? So calmly, Doc. And she said, you know how your children now become your parents? That moment, she became my parent. And she said, Mother, listen to me. Why are we even having this conversation? You will take the medication. I have just lost one parent. I'm not going to lose another. Do you understand me? And she said, thank you, Dr. Bloom. Click. It was over. And I've been on the medication. I have 6 more months to go. I've had my mammogram every year since. And thank God that on this date in 2018, I went in for my annual mammogram, 3D. And that's where they found it. And I'm like, what? And I did everything right, vegetarian and no alcohol, no smoking, exercising. What is it? And we were able to look at some things that was in our vegetarian diet. Soy, we had to look at some things that we had to change. And immediately Micah called me and said, Mommy, get off soy milk, get on almond milk, you know. So since that time, Live to Be Well has been created. My daughter and I do Hope and Healing, Live to Be Well. We do programs all over the country and speaking and on the social media, letting people know that there is hope and healing. But the best way to save your life is to early detection. Saved my life. And I thank God for the wisdom of my daughter And the Bible is true. Raise up a child in the way it should go. When it's old, it shall not depart. And this child is a child of wisdom. And I am alive today because she says, I'm not having it. I'm not having it.
Is this one of those things where, like, in the moment, like I said, I wouldn't have wished that on my mom, even though she didn't understand things that I was going through. I definitely did not want her to have to go through any part of what I had to go through. Again, we've both taken the test. Nothing in our gene. It literally is like the ninth wonder of the world as to why. But here's the thing. It's one of those things I'm like, yo, like, I'm not even trying to continue to figure it out. It is what it is. My responsibility now is if I get somebody in my inbox or I meet somebody and they just want to know or want to feel free to let it out where they are. Because the first thing I tell people when they hit me up that they've been diagnosed, I say, have you really taken a moment to really go through the emotions? Because you have to allow yourself to feel, then deal so that you can heal. If you don't allow yourself to genuinely feel, it won't be the journey itself will be harder for you.
Yeah.
Like I said, 18 weeks of chemo for me, lumpectomy, radiation. It wasn't a cakewalk. I think I made it look to a lot of people like some because I was out, but I had my moments. And I remember going through radiation. I didn't take anybody with me, but that one probably was the hardest part of my journey because it was every single day going to the doctor. And I remember when I finally rang the bell, I went to my car and I just cried. I just cried. And that's when it was interesting because I had my eyebrows and my eyelashes all the way up until my last treatment. And then they went away. And I remember looking in the mirror and I'm like, oh my goodness, I really look like a cancer patient. And I broke down. Being a public figure, that was really hard because I'm out. I'm hosting events. I'm doing this. I remember being at the grocery store and people coming and looking at my cart like, ML6, what do you have in your cart? Do you have all the stuff that you have in your cart that you're supposed to have in your cart? It was just kind of like, it was just a lot. But I remember breaking down and I remember calling my daddy. And one thing I will say, have people in your life that know how to affirm you, that know how to affirm you in your hardest time. I had to let a lot of people go, not because they were bad people, but because they couldn't handle it. I can't be on the phone trying to console you with what I'm going through.
Right.
Do you a favor. I may not even tell you till I'm almost done.
Right.
I may not even tell you at all. We can pick back up where we left off. It's no lost love. When you're going through something, you really have to be protective of who's in your space. Right. That's one of the reasons why I was like, yo, I don't need the whole church to know what I'm going through. I don't need everybody to know what I'm going through. It was Janice Vanderhorst. She called me and she was like, I know you're not over there sulking. I know you're not over there thinking that you're not gonna get out of bed. This is what I need you to do. Janice Vanderhorst is a breast cancer survivor. And she was able to speak to me in a way in which I heard I needed that. Rita Crawford, one of my friend's mother, Pastor Kyle Crawford at Rubidoux, his mother, she was able to speak to me. There were just certain women that their voices, I heard differently.
Right. I want to say that when I went to my pastor at the time, Pastor Dwayne Duncombe, I went to him because Mike is right. You got to process this. I just lost my husband, and I'm like, come on. And, he said, you need a support group. So these 5 women who were praying with me through that, I called up Dr. Juanita Martin. I called Tanya Johnson, Elder Nettie Gray, Elder Beverly King, Sandia Henry. I called these women and they said, okay, we're going to pray every morning, 6:30. And they were the only ones I told outside of my pastor, Micah, my cousin Karen, my brother, and my sister. No one else knew because Mike is correct. You have to be able to have people who's going to affirm you and encourage you, and then keep your business private. And we'll go with you to appointments. And I remember Dr. Juanita Martin said, I will go with you, Elder Nettie Gray, what do you need? And Elder Nettie Gray is a 14-year survivor, her sister survivor. But I didn't hear about this in City Temple. Nobody was talking. So I said, well, I'm going to just tell. Once I rung that bell, I posted it on social media. People were like, what? I said, well, I didn't want anybody to know until I knew and I processed. And then therefore, I can go out now. And one woman said to me, I never forget, Terry Davis, Kim, I've not had a mammogram in 8 years. I'm going. Another woman, I've never had a mammogram. My dentist had not had a mammogram in 13 years. And I told her, I'm going to fire you if you don't go get one. So my thing was like, Micah, now we must go and tell and preach the gospel. And we have to talk about it. And Doc, we can't just do it in October. We need to be talking about breast cancer awareness every month, just like domestic violence, pancreatic cancer, prostate cancer. It's everyday life for people who are going through this. 1 month is not enough time. So I want to encourage our pastors, our churches, to highlight these things so that our church members and people in our communities are not alone. They're not alone. And it was interesting being a mental health specialist. Here I am now on the other side. I can't do this. I can't, And I remember just a week after my husband died, 2 women came to office who just lost their husbands. And I'm like, really? And God says, get back in there because I need you to let them know. And one woman said, you don't know what it's like. You don't know. And I handed her my husband's obituary. Then another woman came in with breast cancer. She said, you don't know. And I handed her a picture of what I went through, ringing the bell. She said, oh, and you're working and you're happy. I said, what am I supposed to do? My God is a healer. And I've got to tell him, for my daughter and I to be on this today, and thank you, Dr. Wells, this is a testimony of God to be a mother-daughter team and to be able to come together and be able to do this. And I love my baby. And you know what I told God? Don't you dare do this to my child. I told him, now you can take me. I've lived my life, but don't you dare take her. And I told him, you said I could come boldly before the throne of grace. Don't you dare. And he says, Kim, I've got something for you coming. You don't even see it coming, and God has done the rest. And now we're out right now. You know what we're doing right now? Letting people know that there's hope and healing.
And let me say this, there's a different cancer for every month. I learned so much about cancers. And it's one of those things where in the church, and it's not just Adventist church, we can do Baptist, AME, Church of God in Christ, Pentecostal. I mean, at the end of the day, there's going to be a bunch of us up in heaven. So let that go. But what I need you to understand is the conversations need to be had.
Yes.
Breast health, liver health, prostate health, brain health, sex education. All of this stuff needs to be talked about and openly, because the streets can tell you all day, social media, Google, all of that. But again, like I said, my age group isn't a part of the statistics. So what is a young girl who's 18, who's in the shower, who may not understand her body yet, and she's not able to talk to her mom because she wasn't really raised in the house where they talked about stuff like that? Would you rather her go out on the street, or would you rather have her have a safe place at the church to be like, hey, let me show you or teach you how to do your self-exam? Like, get to know your body. I know in the church they be like, oh, you're not supposed to know your body. No, you better know your body. You better know how it feels. You better know what's going on in there so that you can understand that when something's wrong. One thing about me, if something's not right, I know I'm about to vomit. I know it's my stomach. I know this is what I'm about to, I can know the difference between my sinuses or if it's a cold. You have to know your body. And there's a lot of women out there, it's a lot of Black women out there that don't know their bodies and don't know what to do. One of the reasons I became such a voice in Huntsville was because Liz Hurley, she's a white reporter on WAFF. She came to me and she says, you have to help the women in your community. They're not going to listen to me. And I was like, what? You're Liz Hurley. Like, you're cool. She was like, no, you have to do this. You have to talk about it. You got to get in front of this. Mm-hmm. And once I did it, I understood what she meant.
Mm-hmm. Yeah.
Like-minded, light-skinned. Oh, you really,
yeah.
I'm young, so I can tell you, like, it's not your grandmother's disease. It's not the deaconess disease. It's the girl who's bagging groceries for you. It's the young girl who's working at Forever 21. It's the girl in her college dorm who doesn't understand that because her mama didn't tell her that her grandmama had breast cancer, and now she's feeling some type of way, and she might have to have a double mastectomy at 21 years old.
Right. Right.
These are the things that are happening in our community, and because we be tight-lipped, we're not helping anybody. And I will say this, Even though I was out, even though my mom was out, there are times where I wish I would have laid down a little bit more.
Mm-hmm.
Listen to your body and know when you need to rest. Even
Yeah.
you don't have to prove anything to anybody. I say this, like, there were days where God would literally knock me down and be like, I told you to rest. And I would be knocked out on the living room floor. Don't know how I got there, but it was because my body was tired.
Right.
Listen to your body, know your bodies, go get checked. Yes, the statistics they're there in black and white.
Right.
But when this thing hits you, you don't want to read nothing, you want to look at nothing. You're trying to figure out how can I handle this mentally, physically, emotionally, and most of all spiritually. Because I'm telling you, it's a spiritual walk like none other. It's gonna take you down through it and really, really test your faith and trust in God.
I want to say thank you to my home church who prayed for their daughter Micah and I, the deacons, my elders, my pastors. Even today, we had Pink Day today at City Temple, and Deacon Wendell Martin had on pink socks, pink shirt, pink tie. Everybody was just amazing. But we do this segment called the City Temple Cafe, and just supporting. People came out today in pink at my church, and that meant a lot, and I'm going to be a voice. And even when I was at Oakwood, there was never a class of self-examination or talked about. So come on, Oakwood, Andrews, and because I go to U of M, Michigan State, Wayne State, everybody's talking about these things. But excuse me, our schools, our academies, Pine Forge, they're not teaching and they're not talking about it. It is time to change the dialogue and the conversation. It is time. We're living in a different age now.
No, that's so wonderful. And I think this is why we're doing this now, so that we can bring awareness and so that other people can understand your journey, one, and to feel confident in their own journey, and also to know what they can do so that they can prevent breast cancer or it can be detected early.
Yeah.
And so I think that you guys had some wonderful, wonderful, awesome stories. I'm sad that you had to go through it, but you know what? I believe this. I believe that, sometimes we say that God never gives us something that we cannot bear.
Mm-hmm.
And I believe that God does give us things sometimes that we cannot bear.
Mm-hmm.
But he never gives us things that he cannot bear with us. Yeah. And so whatever we are going through, God will give us the power to get through it. And so I thank you for sharing your story. The only thing that I want to say, and we're going to talk about this in the next segment, that soy gets a bad rap. But we're going to talk about this in the next segment, that soy is not bad. It's not that soy that is a bad thing. So I want you to drink your soy milk. I want you to eat your soybeans. I want you to eat tofu, because they're actually anti-inflammatory. They actually help prevent cancer, and they are not the same as the estrogen that we produce internally. So plant estrogens are very different. They're very good for us, but stay away from the process.
Yes.
And anything processed is real good. So soy burgers are not good for you. Eat those soybeans.
Yeah.
Just everything in moderation. Everything in moderation. That's from the top to the bottom. And to your point about God giving us more than we could bear, my pastor at the time, Pastor AD, he said it's not our responsibility to question God in terms of like how much he gives us. It's our responsibility to ask him to give us a stronger back to carry the load that he's given us.
That's wonderful. That's awesome. I like that one too. That is so great.
Wait a minute, together before we go off this segment, you got to say, I'm going to say 1, 2, 3, and everybody's viewing, you know what I'm about to do. 1, 2, 3, live to be well.
We all know that. You guys are so inspiring. I got to get you on so we can talk about some other health things, because you guys are just so inspiring. I love what you're doing, Micah. I love the voice that you're being. And the example that you're being to other young Black women. We praise you for that. We thank you for it. We support you in that. And we praise God for the ministry that you have where you are. And we thank your mother for being who she is and for being supportive and for being on this show today. We appreciate you guys. We know you guys got to run.
Yeah.
But we thank you so much for
Yeah.
being on today. And Mike, I'm gonna have to borrow a pair of shoes. But thank you guys so much for being on today. Thank you for sharing your story. Have a wonderful, wonderful
Thank
afternoon.
you, sweetie. Bye-bye.
All right, that was so inspiring. I almost shed a tear there. Their stories were just so, so wonderful to hear how they came through breast cancer. Just to hear Micah and her being such a young woman, but how God brought her through is so amazing. And so now for our last segment here, we're going to bring on Stephanie, who's going to talk to us a little bit about eating and the ways that we can manage our lifestyles to help prevent breast cancer. How are you, Stephanie?
I'm doing so good, Dr. Wells. Thank you so much for inviting me to the breast cancer awareness program that you've put together. Such inspiring stories. As you said, I'm Stephanie Ignafo, CEO and founder of Plantspiration. I'm a plant-based nutrition expert, lifestyle medicine coach, and today I'm your Food for Life instructor with the Physicians Committee for Responsible Medicine. I teach people how to prevent and reverse chronic disease using foods from their local grocery store. And as we are learning today, breast cancer is the leading cancer among women. And I'm going to teach everybody here how we can prevent it by up to 95% just by what we bring home from the grocery store, diet and lifestyle changes. You know, I was told that this was hereditary, like most people. You know, I was doomed. I lost my grandmother to breast cancer, her mother to breast cancer. I was overweight. I drank. I didn't exercise. And the only plants I ate were with butter, cheese, or oil. I learned it wasn't so much my genetics, but what I had genetically learned to eat. Today, I'm going to share with you how I reduced my risks significantly, and I'm going to teach you how to change your destiny too by what we're putting on our plate. But before we start, I want to let people know I didn't always talk about plants. I didn't always know how to cook plants. Real quick, this was me before. I spent my life dieting, trying to lose weight, trying to be healthy. And one day my daughter came home, said she wanted to go vegan. And I said, that was the worst idea. You're going to die of protein deficiency. Soy is going to cause cancer. But 10 years later, I have now made it my mission to teach people exactly the things that we should be talking about, nutrition. And I talk about the latest in evidence-based nutrition. A lot of people say, Stephanie, I don't have time to go plant-based. I'm going to show you how easy it is. We're going to start off with breakfast. A lot of people don't have time to make breakfast in the morning, so I'm going to show you how to do it nice and easy, using just regular oats. How do we make this work? Low fat, high fiber. You'll hear me talk about that a lot. I stopped dieting when I did this, and I just started eating plants. We're going to start off with just regular old-fashioned oats. These are great to use. You actually don't have to cook them. You just have to add a little bit of plant milk to them. I'm going to talk about using soy milk today because as we are learning, or as I'm going to talk about, soy is so preventative for cancer. It can help fight cancer. If you have cancer, it's great for you. If we want to prevent it, it's great for you. I'm adding in 1.5 cups of soy milk to my 1 cup of oats. We already have a bunch of protein in here, a bunch of fiber in here. And now we're going to add in some antioxidants, our fruit, our next cancer fighter. We've got the soy, we've got the fiber, and now we've got a cup of frozen blueberries. Frozen fruit and vegetables are excellent to use. They're inexpensive, they're easy, they're attainable. And if you have kids, they're going to like the blue milk that comes with it. We want to add some chia seeds in here and get that extra cancer fighting going. We know blueberries are super cancer fighters, but there's there's even something more powerful. It's the gooseberry, and you can get it into this omelet tea here. It's easy to get into your tea. It's easy to use. Just extra cancer fighting tips. So you just take your oats, your soy milk, your chia seeds, and a little bit of maple syrup or agave. You can actually eat it right now. It doesn't have to soak overnight, but when it does, it's even better, and it comes out beautifully. This is high fiber, low fat. I'll get into a little bit about that more, but high fat foods really promote cancers. And when we keep our weight down, we can reduce our risk tremendously. 70% of women with breast cancer are overweight. And I'm going to show you that if you continue to eat this low fat, high fiber lifestyle, removing animal products is a big part of it because animal fuels cancer, animal protein. And when we bring in plants, it fights cancer. So with every bite, we're either feeding that disease or we're fighting it. And once I learned how, this became easy. I wanted to eat to live. It's beautiful. It's delicious. It tastes like a blueberry muffin. You could eat it for breakfast. You could eat it for lunch. You could eat it for snack. What I teach my clients is there's no restriction. There's no counting calories. There's no counting points. We are literally eating a naturally low-fat diet that we don't have to restrict carbs or calories in order to do so. So next up, I thought it would be really great if we talked about soy again. So we're going to be making some tofu scrambles. What I have right here is a package of firm soy, really easy to use. There's other, well, here it is with the package already on. I definitely recommend an organic when it comes to eating soy. There's silken soy, which is great for Alfredo sauces, chocolate mousses, and of course, I love tempeh. It's even higher cancer fighter because it's fermented from the soy. Okay, so we're going to start off by, well, Stephanie, how do we cook low fat? I'm going to have you take the oil out. Nobody needs oil. It's an inflammatory. We're going to reduce our risk by reducing the fat. 2 tablespoons of olive oil, by the way, is 27 grams of fat. We shouldn't be going over 30 grams of fat a day to keep it low fat. So I'm just going to quick saute up some onions. Let me get my tray over here. We don't need oil to saute an onion. So I've just got a couple, half of an onion here already chopped, no oil needed, because really the oils are already in all our plants. Once we've removed the fiber and the nutrients and the antioxidants and the water, we're left with 100% oil, which is 100% fat. So in order to prevent breast cancer, we want to get to a healthy weight, and eating low fat is really how we do that. Simple things like that. I don't want to take out the flavor. I just want to take out the things that are promoting chronic disease. I don't just teach people how to prevent breast cancers. You guys talked earlier about heart disease. It's the leading killer. Plant-based, whole food plant-based, what I teach reverses heart disease. It's a food-related disease. Type 2 diabetes, type 1 diabetes is increased by dairy. So we can really change our destiny just by what we bring home from the grocery store. How many of you guys buckle up when you get in the car? Probably everybody's raising their hand because it's smart to keep ourselves safe. And we're really talking about keeping ourselves safe when we're talking about preventing breast cancer. What you bring home is just as important as putting on that seatbelt. What we put on our plate will reduce our risk. We're going to add in some fresh garlic. As we all know, garlic is an allium. It fights cancer, and we should be eating garlic every day in everything we eat. Little bit of garlic, little bit of onion. And if you're cooking and it gets a little dry, just add a little bit of vegetable broth. Nobody's even going to notice that you took that out. The flavors are going to be incredible. Next thing we're gonna add after we saute this up is a little bit of red pepper. We're gonna add a little bit of green pepper. While that's simmering up, I'm gonna show you just a quick way to cut a pepper to keep it easy. You can't forget all these foods are so low fat, such high fiber, we don't have to restrict. One of the biggest obstacles I find with people is they don't eat enough. They're thinking that this is a diet or that they want to lose weight, which of course is what we want to do, get to a healthy weight. But this isn't about dieting. This is about healing, preventing, reducing our risk with every bite. Once you cut each end off, you've got this really nice strip, and you can go ahead and chop it up simple like this. Easy ways to do that. I wasn't so fluent in the kitchen before plants, but this changed my life so much. I've made it my mission and my passion to educate, to motivate, and I pray to inspire more people to improve their quality of life and reduce that risk for breast cancer. I wasn't always this size. Actually, I was never this size. These were what I would call my skinny pants. All the diets I've been on, all I wanted to do was get in these. Started eating plants, went way past that, and I want to show you how to get there too. We've got these beautiful vegetables, and I lost my mushrooms. I'm pointing to my assistant. Thank you so much. Mushrooms are so important. We forget that they are so high in fiber, one of the only plant foods to contain vitamin D, which we need. Vitamin D is another big thing to get in you to fight these chronic diseases, especially cancers. And one mushroom a day can reduce your risk of breast cancer by up to 67%. Let's start eating our plants off. Again, low fat, high fiber. We're gonna saute those around a little bit. We're gonna add in our tofu. Tofu is amazing, okay? No meat, no problem. When you're eating tofu, which has protein, it has fiber, it has phytoestrogens, which protect us. We get, everybody asks about protein, but we should be asking about fiber. The importance of fiber is so significant. Fiber doesn't just fill you up and keep you satiated throughout the day. Fiber boosts your metabolism and it excretes. It literally takes out that excess estrogen. As we learned, excess estrogen can fuel cancer cells. Excess estrogen is caused by being overweight. That promotes that excess estrogen. So not only are we working on that, getting to a healthy weight by eating all the beautiful grains, greens, fruits, and vegetables, but it's also excreting that excess hormone out that we don't need in our bodies. Once you take out the dairy and the meat, you're definitely reducing your risk. Now I want you to fight it even more by what you put on your plate. We're gonna just crumble up the tofu nice and easy. If you're making this for breakfast for your family, nobody needs to know. This is gonna taste exactly like tofu scramble, or like a scrambled egg. These recipes, I wish I could take credit for them, but as a Food for Life instructor with the Physicians Committee, I get to use their 20-year evidence-based program. It started off with the Cancer Project. This has been around for over 20 years. Dietitians, doctors, nurses help put these recipes together, and I'm here to teach you how to do it. Dr. Wells has a link that she can share that will have the recipes and everything I'm talking about today. I just added some powerful turmeric in here. We're gonna add the turmeric, which gives it that yellow flavor. We've got that garlic, the cancer-fighting onions, the mushrooms, and the soy to top it off. Eating whole food plant-based does not need to be difficult. Keep it simple. Make sure you're eating copious amounts. I talk to people often about getting in 3 to 5 pounds of food a day. It's already naturally low fat, so you don't need to hold back. I lost 100 pounds and reverse my diseases by changing my diet and lifestyle. And my family lost 250 altogether because I stopped bringing animal home. And when I found out that by putting animal on my plate could increase my risk with every bite and the health of my family, I wanted to change my destiny. I wanted to change my outlook on life. I went from crippled to cranking because of what I brought home from the grocery store. Next, I'm just gonna throw in a little bit of black pepper. You can season it with many things that you like. You could add tomatoes in it, but I really like something called Kala Nama black salt. It tastes like egg. So instead of the one egg that has the same cholesterol as 2 Whoppers, we can have all of this, everything I'm showing you today, with 0 cholesterol. We already make cholesterol, so we don't need to have it in our diet. Dietary cholesterol is not essential, and it's a big part of getting that weight down. So we're gonna add in some Kala Nama black salt, or just salt. If that's all you have, that's fine. A pinch of that, stir it up. We're really just heating this up and getting it sauteed together. And that's how quick you can have a tofu scramble. Maybe you want to add some broccoli with it. Broccoli is another one of those massive cancer fighting foods that we should be getting in every day. A half a cup of broccoli is super powerful in not just preventing, but fighting cancers. This is great for breakfast. This is great for lunch. This is great for leftovers. You can freeze it. And this is how I teach people to batch cook it. This is sauteing up really nice. It looks lovely. You could even have potatoes with this. Or the way that we like to use them is on a little corn tortilla. So many people are afraid of soy, and I get it. I was one of them. Watching my grandmother fight, being told by doctors that she shouldn't have soy, she shouldn't have fruits. I'm really passionate about making sure we get this information out there. The evidence is there. We know that this was a rumor that got started over a mouse getting straight up isoflavones, and that's what they saw, and they turned it into this. This could be the farthest thing from the truth. You can look at Japan. They're 6 times less likely to get breast cancer because of their high soy, high carb vegetable lifestyle. But put them on the Western diet and boom, down goes those statistics, okay? Now they're back up to this chronic disease rate. 8 out of the top 10 deaths in the United States can be prevented and most reversed by a whole food, plant-based diet and lifestyle. And I hope to inspire you to make those changes. They can be easy. Don't make it overwhelming. You know, things like pasta and marinara sauce. These aren't the things that promote insulin resistance or chronic disease. These are the very things that my clients and other people out there are using to reverse their disease, or maybe on a nice piece of toast. I want you guys to eat your plants off and fight that disease as much as we can. The leading cancer among women, we can do something about it. 95% of breast cancer can be prevented by taking that meat and dairy off your plate and putting on plants. So that was a quick recipe. Does anybody have any questions? You know, feel free to add in the chat box, and Dr. Wells can relay them to me while I get down to my final recipe. A quick bean recipe, black bean chili recipe. Easy stuff. Everybody's busy, everybody's working, and everybody deserves to live their best life. And I want to inspire you to do that too. I know there's tons of recipes and there's tons of information out there on how to do this and how to get this right. I am teaching the latest in evidence-based nutrition and how easy it is that we can do that. So it doesn't have to be all complicated. We're going to make one of the simplest, easiest, high fiber, low fat, black bean chilies. It's one of the most versatile things I've ever taught people how to cook, and one of the first things to keep people going. All you need is a pot, a can opener, and take your beans and rinse and drain them. While you drain them, though, all you need to do is save the reserve from the beans. You might not need it, but I'm going to show you a little trick. All right. No meat, no problem. By the way, all protein, I found out the hard way because I had to prove my daughter wrong. All protein comes from plants. All plants contain protein, and all protein comes from plants. Not only do plants contain protein, they contain a tremendous amount of fiber that's going to fill you up, and it's going to excrete that excess estrogen out of our body and help reduce that risk. We've got 2 cans of black beans rinsed and drained. That's it, right? You guys could do that. We've got 1 jar of salsa, any salsa that you like. Not only are these lycopenes in here super powerful in fighting cancers, not just for women, but for men as well. We're going to throw in our jar of salsa, and the easiest, a frozen bag of corn. You only need about 10 ounces, and you heat this up. Throw in a little bit of the reserve if you feel that it needs it. I've made this enough times that I know my can of beans and what I'm doing does. And this can be used over chili. As a chili mac. It can be used over potatoes. You can also put it with a side of broccoli or some greens. I want and I teach people to keep things easy, and I like to empower them with the nutrition information of food. The darker the bean, the higher the antioxidant, the more powerful it can be. Fiber boosts metabolism. Fiber fills you up. No dieting here. This is eating to live. We have so much control over what we're doing with our mind and our body every day. I know life can be stressful. I know it can be overwhelming, but when we focus back on ourselves and our health, that can be the most rewarding. That's what I want to teach you guys. How do we keep our risk 95% lower? We want to keep a healthy weight. How do we do that? Give up that animal, that high fat, high cholesterol food. 1 to 2 servings of high fat dairy increases our risk of mortality by all causes. I hear you in moderation, but I don't moderately buckle up. I want to keep myself safe 100% of the time, and I want to teach you to do the same thing too. So we're going to keep it low fat, whole food, plant-based. We're going to get a healthy body weight, and we're really going to limit that alcohol. 1 drink increases your risk 10% of breast cancer. 2 drinks, double that, and so on and so on. A lot of people say, Stephanie, resveratrol is in wine. Isn't that good for me? Well, that comes from grapes. I want you guys to eat the grapes, not the wine. Did we have a question, Dr. Wells?
I came back on because you said that this was your last recipe, so I thought you were wrapping up.
That's it.
And
That's
so, but I do have a couple of questions for you, and I thank you because these are some great recipes, and we encourage you to take these, modify them as needed. But I think these are some great things. You brought up some great points, Stephanie, about fiber, and I think fiber is like, if fiber was a company, they would owe me a lot of royalties because I am always promoting fiber because it's good for so many different things. It's just a wonderful thing. And so I always am encouraging people to eat more fiber. And so I'm glad that you brought it up because fiber can help you with so many different things. So that was really, really good. I appreciate that. I also appreciate you talking about estrogen. And we know that estrogen and soy, has gotten so much of a bad rap. And we know that as human beings, as animals, we're animals, that we produce a certain type of soy. But that is different than the phytoestrogens that are produced in plants. Yes. And they have a very opposite reaction. And so animal protein and animal soy can be very, very, very harmful. The soy we produce ourselves, that is. And that's why milk is also harmful because milk has a lot of estrogen in it, which is not healthy for us.
No.
However, the phytoestrogens that are produced in plants, they have a beneficial impact on our health. And so I know we're going to wrap up here, and I'm going to bring Dr. Sharon back in, Dr. Rahman back in. Dr. Rahman, we're bringing you back in, and we're just going to close up here and see if there are any questions. I know, Stephanie, you're wrapping up, and if you wanted to say anything else, or Dr. Rahman, if you wanted to also pitch in anything about lifestyle, diet. I know, Stephanie, you mentioned a lot about exercise, weight management, eating more fiber. Don't be afraid of soy. Soy is your friend, but you want to eat soy in non-processed forms.
2
So
to
no
3
soy
servings, 2 to 3 servings of soy a day help fight cancer. Soy every day reduces your risk of cancer. More information would be the link that I gave you. Dr. Christy Funk, the breast surgeon, we've teamed up, her, myself, with the Physicians Committee for the Let's Beat Breast Cancer campaign, because it's vital we get this out. We can prevent by up to 95%, and 75 to 90% of cancers can be reduced by this information. So thank you for letting me share this. I teach Food for Life classes every week, and they're always available, from heart disease to diabetes. We have a new program, the African American culinary classes, coming up in February. So I encourage everybody to learn how to get in the kitchen, how to keep it easy, and how to improve quality of life from yourself, the animals, and the planet. And I pray that I've inspired all of you today to make these changes. And thank you for having me, Dr. Wells, and everybody. Thank you.
Yes, it was definitely wonderful. I wanted to ask you another question, Stephanie. Can you give us really quick again that recipe for the overnight oats?
Oh, sure. It would be 1 cup of oats, 1.5 cup of plant milk, half of a tablespoon of chia seeds, 1 to 2 tablespoons of maple syrup, and a cup of blueberries. And I want to add one more thing about soy that I get the most questions of, I may add. Many people are afraid men are going to get breasts or breast development from soy. And there's something here I'd like to say. If soy increased breasts, it would be the largest selling food in the nation. I eat soy every day, and I'm still an A. So think about that for a minute, and thank you again, you guys, for having me.
Thank you for adding that. We know that, again, the phytoestrogens in plants actually help us to balance testosterone. So thank you for that information. They will not grow breasts. Dr. Rahman, thank you for showing that one looks pretty good. You have a good shot there too, Stephanie.
Good, thank you so much.
Dr. Rahman, do you have anything else, or Stephanie? I just want to know if you guys have. There was one quick question for you, Dr. Rahman, and then Stephanie, if you have anything else that you want to share. Someone asked, "What do you think about the flap surgery?"
I don't have an opinion about that. That's not what I do.
Okay.
I wish I could give a better answer.
Okay. And I don't know much about it, so I can't give an answer about that as well. So one more, Stephanie, do you guys have anything else that you want to share with our audience? We're going to wrap up here. We thank everyone for joining us today. Any closing thoughts, suggestions, advice that you'd like to give to our audience today?
I would like to add, don't just take my word for it. Do the research. It's out there. Empower yourself. And thank you so much for watching this, being here, and please share the facts that we have things we can do about this.
I would say thank you for this opportunity again. I've totally enjoyed it. It was very enlightening. And my wish for everyone is that we would start to realize the power that we have. We have the ability to take control of our health. We don't have to be dependent on medications or surgery to the extent that we tend to believe that we can. We can eat to live. Sometimes we can actually eat to heal. And that's actually life changing. That's revolutionary. And when we start to accept the possibility that we're now in control of our health, it helps us to have a better quality of life. And I think the two ladies that were on earlier just emphasize just how precious life is and what you are willing to do to be living. And if that's the case, do everything that you can to optimize your health while you can.
Well, thank you, ladies, so much. That was so wonderful. I thank you for all your participation. I thank Dr. Kim and Micah and Dr. Rahman and Stephanie so much. This was such an inspiring, such a great program today. And I am going to take what you just said. We have to eat to live, but we can also eat to heal. And so food is life and food is healing. And so we hope that you've been inspired today. Again, please share this program with your family, your friends, and your community. Until next time, have a wonderful, wonderful afternoon. You guys take care. Bye-bye.
Thank you.
Thank you so much.